What causes scoliosis to worsen? Many times I get asked the question, is scoliosis a progressive condition? And yes, scoliosis has it in its very nature to worsen over time. As scoliosis progresses, it makes it harder to treat as curves become bigger. So how does progression of the scoliosis affect the spine? First thing, as the unnatural curves increase in their size, they create more deformity and they create something called more spinal rotation. And as we get more deformity and rotation, the ultimate thing is the spine gets more rigid. These curves become stiff. And as they become stiff, this increased spinal rigidity and stiffness makes the spine less responsive to all forms of treatment. This is surgical and non-surgical forms of treatment. Rigid spines can make it also more difficult for patients to perform activities and have greater restrictions on patients' life, and also can be more likely to cause pain and dysfunction. So as scoliosis progresses, it becomes more severe in its effect, becomes more noticeable, and it affects more issues than just the spine. It can affect muscles and nerves, which can lead to pain. So when we look at progression, how do we know which curves are going to worsen and which curves are not? Well, unfortunately, we can't predict the exact nature of someone's progression. It's unique to them. It's like a thumbprint. As a curve worsens, it's more likely to worsen, but to pre-predict which curves will worsen and at what rate and to what size is physically impossible. We know the number one trigger for progression is growth. And this is children entering into puberty are at the greatest risk for rapid progression during to unpredictable rapid growth spurts. The most prevalent form of scoliosis is definitely adolescent idiopathic scoliosis, which is typically diagnosed between 10 and 18 years of age. And because it's normally diagnosed in this form, is because this is when they're going through puberty. This is when the curve is getting bigger, the postural deviation is noticed, and therefore the x-ray is taken and they're diagnosed with scoliosis. This is why this is the most common time of diagnosis is in adolescent. This is why this is the most commonly associated form of scoliosis is adolescent. However, adolescent patients aren't the biggest population or group of patients with scoliosis. It's actually adults. Adults have the largest population of patients with scoliosis. And in fact, it's directly related. As the age group increases, the population percentage increases as well. And this is because this is all the undiagnosed kids the kids that don't get diagnosed that actually find it in the adult form. And then this is all the diagnosed children that have it in the adult form. And then it also includes all the adult onset cases. So young and middle-aged patients tend to progress very slowly because this is slow progression as a result of gravity over time. And this progression is directly related to the size of their curve. So a 50-degree curve will progress faster than a 40, and 40 faster than a 30, and 30 faster than a 20, because it's gravity over time. It's kind of like an underlying car that the more the gravity affects a curve, it progresses. But as this progression occurs and as the curve becomes bigger, it's more likely to cause pain. Number one reason why diagnosis occurs in an adult patient is because it's pain. This is because the pain and the progression in the adult patient is compressive over time, and compression will almost always lead to pain, where growth is non-compressive, which almost never leads to pain. So in adolescence, progression is growth, non-painful. In adult patients, it's compressive, so it tends to be painful. Now, larger curves are more likely to progress in both stages. So as your curve gets bigger, it's more likely to get bigger faster. In adolescent cases, once curves break 40 degrees, almost every single time that patient grows, it's like a 96% chance it will worsen. So as the curve breaks 40 degrees and you're still growing, it's almost 100% guaranteed it's going to worsen at that stage if left untreated. In adult patients, curves that are 50 degrees progress about 1 to 2 degrees a year, but curves that are less than that progress slower. So bigger curves progress faster in the adult stage. Also, as that curve becomes bigger and the patient gets older, it tends to progress faster. So when we look at elderly patients, they tend to progress faster than a middle-aged adult. So everything being equal, an older patient will progress faster than a younger one. Everything being equal, a bigger curve will progress faster than a smaller one. Older patients can also have more rapid progression. We start seeing an increase of more rapid progression in 60 plus years of age. For women, it tends to be closer to this menopause phase between 50 and 55 years of age. And this is a result of the asymmetrical spine being there for so long, leading to asymmetrical degeneration, which tends to express itself somewhere around the 50 plus years of age range. This progression starts to double its rate as patients get older. So let's say you have a 50-degree curve, you're doing 1 degree a year in the middle-aged range. You start breaking 50, you start doing 2 degrees a year. You start breaking 60, you start doing 4 degrees a year. You break 70, you start doing 8 degrees a year. 75, you start doing maybe 15 degrees a year. So you start seeing this rapid progression in later stage life, which can be very concerning because as this curve starts collapsing in later stage life, it can be very difficult to treat. So in the progression in the adult stage is, I call it, compounding, or like a snowball effect. It starts off slow, but it increases its rate as it gets bigger and you get older. Where in adolescent, it's very up and down. Like it's progression, then no progression when they're not growing, progression when they grow, no progression. So it's very cyclic. Cyclic progression in the adolescent stage, compounding progression in the adult stage. Adolescent stage, the progression doesn't cause any kind of pain. It's postural problems that brings on the diagnosis. In the adult stage, it's normally brings on the diagnosis is pain because of the compressive nature of scoliosis causing degeneration and pain to nerves and tissues. Regardless of the age, we know treating your curve when it's smaller is going to produce a better result. So smaller the curve, the better the result regardless of age. And we also know younger patient is always going to produce a better result in the same person. So there's no benefit in waiting to see what's going to happen to your curve because more than likely your curve is going to worsen. It's going to worsen quickly, possibly quickly in the adolescent stage or slowly in the adult stage, but you're going to see worsening more likely in some part of your life. So it definitely makes sense to try to reduce the curve, make it smaller so it's has less influence on these progressive factors. And as we reduce your curve, we want to stabilize that reduction and monitor your scoliosis over your life so the curve doesn't create this compounding effect, which leads to more pain and disability in later stage life. So that's why every effort should be meant to prevent progression as close to the time of diagnosis of scoliosis as possible.
Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.